Hello friends, today I am presenting an assignment on the feline myeloma, an overview. The course is VPL 604 and course title is Veterinary Immunopathology. So first coming to the introduction, as you know that all plasma cells originated from the B cells, and it produces or it secretes antibodies, but sometimes plasma cells become spontaneously proliferates, and uncontrollable proliferation of the plasma cell leads to the production of the myeloma cells. So the myeloma cells are basically a cancerous growth of the plasma cells. So here in this picture you can also see that the presentation of the bone marrow, and there is a production of the uncontrolled plasma cells leading to production of antibodies. So why this myeloma produced, and why this cancer is to be produced? It has unknown origin, especially in the felines, and there is no breed or sex predilection is to be seen till date. About 0.9% of all myelomas are about 0.9% of all malignancies are related to only myeloma, and about 1.9% is related to the other hematological malignancies in especially felines. So according to the location of these plasma cells, these myeloma cells, it has been divided into solitary osseous plasmacytomas and extramedullary plasmacytomas. When the plasmacytomas is generated in the bone marrow, it is called as solitary osseous plasmacytomas, while when the generation of these plasmacytomas outside of the bone marrow, it is called as extramedullary plasmacytomas. Here in this picture it is depicting that the plasmacytomas is producing different type of the antibodies, and different type of the chains, light chains or kappa chains, but especially in myeloma cells they are monoclonal in type and producing monoclonal gammopathy. Means either they are producing light chain or either they are producing heavy chain. Sometimes there is a change in the ratio of kappa and lambda chain also. So sometimes the myeloma cells also produce not light chain, but can also produce a altered part of kappa chain or altered part of lambda chain. But a rare case of myeloma having polyclonal gammopathy is also reported now. So further myeloma, multiple myeloma production is should be reported, and more studies to be required in case of the feline species. Now these are the different sites where the plasmacytomas has been takes place outside of the bone marrow. Sometimes the plasmacytoma or the multiple myeloma takes place in the orbital plasmacytomas, in the orbits or in the eye. Sometimes it is in the duodenum, sometimes it is on the skin or on the trunk, on legs. Sometimes the generation of plasmacytomas in the oral cavity, esophagus, stomach, intestine and rectal area. So they have a different tendency to grow at different locations of the body, and it has been seen and reported in felines. So sometimes it has been reported at the paws of the cat. So here there is one picture of the paws, you can see in this picture. So there may be production of the different type of the antibodies, and these antibodies accumulated in different organs leads to organomegaly. So here at right side corner there is one spleen cell, spleen, and it is showing multiple hemorrhages with splenomegaly, and in the biopsy there is multiple round cells having eccentric nucleus is to be found. So there is no any exact cause of the disease has been known, but some researcher like Hannah F. In 2005 reported that it may be due to genetic predisposition in the felines. Now comes to the pathogenesis. The myeloma cell production has been takes place especially in case of the bone marrow, and when they produce in extra quantity or in large quantities, these cells produces different type of cytokines, especially interleukin 6 and tumor necrotic factor alpha. The interleukin 6 is mainly responsible for production of osteoclastic cells, and it may leads to diminish the production of the osteoblast. Further, it may leads to bone destruction, and the lytic bone lesion is to be seen. So there is more calcium is to be produced, and that calcium is further damage the kidneys. Other pathogenesis are also is there. While production of multiple myeloma in the bone marrow, no other cells has access for the production, and that may leads to different type of the lymphopenia, neutropenia, thrombocytopenia has been takes place. If there is any infection and there is a neutropenia, definitely we cannot overcome this infection, and the infection will be further aggravated. Sometimes when there is a thrombocytopenia, definitely there is a problem of bleeding diastasis, and there is a multiple hemorrhages in the bodies, and the animal will die only due to the hemorrhages. Now the other part of the pathogenesis of the multiple myeloma is the production of the paraproteins. These paraproteins are basically the immunoglobulins, and they are either altered chain of the immunoglobulin. We are also called these paraproteins are M proteins, or we call it as a M component. So there is a production of these paraproteins, and these paraproteins further leads to hyper viscosity of the blood, and it may leads to further hyper viscosity syndrome. These paraproteins also deposited in the different organs like spleen, liver, and heart and kidney, so it may leads to different organomegalies. Here the photograph is to be shown that the myeloma cells producing antibodies, and these antibodies adhere to the myelin sheath of the nervous tissue, leads to demyelination, and further it aggravates the paraplegia, convulsions, coma, and dementia in case of the kids. There is a different mechanism for the hypercalcemia, that these cancerous cells also produce interleukin 1, interleukin 6, so it activate the RANKL यानी कि receptor associated nuclear kappa ligands and receptor associated nuclear kappa. So the both receptor and ligand binding is to be takes place, leads to activation of nuclear kappa. It will further activate or increase the expression of osteoclastic cells and decrease the expression of the osteoblastic cells, leads to absorption of the calcium from the bones. So finally, due to this pathogenesis, there may be renal failure, there may be anemia, there may be production of monoclonal proteins in the urine, and that all have a diagnostic value. In case of the captive lion, the multiple myeloma were reported showed osteolytic activity, osteolytic lesions, monoclonal gammopathy in the serum with excretion of monoclonal proteins in the urine, neoplastic plasma cells in the bone marrow, and associated renal failure and anemia. Now, other pathogenesis has been also reported, like hypergammaglobulinemia, monoclonal biclonal gammopathy, hypoalbuminemia, light chain proteinuria, hypocholesterolemia, then hypercalcemia, anemia, neutropenia, thrombocytopenia, meroplasmacytosis, Benz-Jones proteinuria, hyperviscosity syndrome, and amyloidosis. Now comes to the symptoms in the feline that has been reported. Out of them, anorexia, lethargy, and bleeding diastasis are having main focus. Out of them, anorexia is about 70%, lethargy is about 65%, then bleeding diastasis is about 30% in the kids has been found. Then other symptoms are lameness, ataxia or weakness, then palpable abdominal organomegaly, vomiting, diarrhea, dysphagia, polyuria, neurological disease, and skin masses. Now comes to the pathology. As we already know, there is a production of paraproteins leads to organomegaly, and there is a production of different type of cytokines leads to lytic bone disease. So in the pathology, multiple punctate lytic lesions in the bone. The lytic foci consist of soft, fleshy or gelatinous dark red nodule replacing tubercular bones. The lesions are often multiple and may be associated with a pathological fracture. So sometimes the feline has been found with multiple fracture, or in the radiographic lesions they have seen lytic bones or lytic activity, lytic lesions in the different long bones. Histological or cytological examination reveals a relatively pure, dense population of plasma cell which may be well differentiated or large anaplastic round cells with a high mitotic index. A monoclonal cryoglobulinemia associated with the multiple myeloma, monoclonal IgG gammopathy, hypercalcemia, high alanine and aspartate transaminase activity, thrombocytopenia has been also reported in the kit. So in all these pathology, the main pathologies are production of M protein, that is all in case of the 100% in all cases. Then monoclonal antibodies formation, about 80% cases has been reported. Biclonal polyclonal production has been only 20%. So there is a more production of monoclonal antibodies rather than the biclonal or polyclonal. There may be anemia. There is a production of Benz-Jones proteinuria, azotemia, thrombocytopenia, neutropenia, hypercalcemia, and there is a seronegative of other disease like feline infectious feline immunodeficiency virus or feline peritonitis virus. So this picture depicting that in the radiographic representation there is a multiple lytic lesions in the long bones. So you can see here in this picture, and here you can also see. So if they are multiple in the numbers, definitely it may be due to multiple myeloma. This is another picture showing high mitotic index like in this cell and in this cell. So they have binucleated or single nucleus. They may also anisocytosis, like in this the size of this cell is very large while the size of this cell is very small. So there may be anisocytosis is also be seen. Now in this picture you can also see there is a MOT cell, and in the MOT cell there is a presence of immunoglobulin inside of the plasma cell. In this picture you can see there is a different type of the plasma cells having eccentric nuclei, and these multiple myeloma cells is to be seen clearly in this picture. Here the multiple myeloma has been seen, and about 60% of bone marrow aspirates showing multiple myeloma cells. This is a liver biopsy, and you can see especially this cell and this cell. These are cells are having eccentric nuclei, and they are multiple in the number. In this picture again you can see the mitotic index, high mitotic index in this picture. So now considering all of that things, we can diagnose the multiple myeloma first on the basis of the biochemical examination, like increase in the calcium level. There is a production of M protein, then Benz-Jones protein also found in the urine. Then renal insufficiency is to be checked by creatinine level, then hemoglobin level, and in this case there is maybe anemia and decrease in the hemoglobin level. There is increase in AST and ALT level also. We can also diagnose by radiographical examination. In the radiological examination there is osteolytic bone lesions on the skin radiography. Now next is the cytological examination. In the cytological examination, clonal bone marrow plasma cells, that is more than 10%, or biopsy proven bony or extramedullary plasmacytomas are more than 1%. So almost in 100% cases of the myeloma cells, about more than 10% are bone marrow originated, and about 1% are extramedullary plasmacytomas. So other clonal bone marrow plasma cells, if they are more than 60%, so it should be considered myeloma, multiple myeloma. Now next diagnosis should be done with serological tests like serum protein electrophoresis, then urine protein electrophoresis, and immunohistochemistry. So comes to the conclusion, the multiple myeloma has been should be differentiated by the other diseases like feline immunodeficiency virus, feline peritonitis virus, and coronaviruses of the felines, and they require early diagnosis so that the animal should be treated. Otherwise this disease is very fatal and cannot be treated in the late response. So hopefully this lecture may be helpful for your studying purpose, for your knowledge, and it may be helpful for further conclusion in the myeloma. So hope you are enjoying this lecture. Thanks for listening. Thanks.